Hello, everyone. I just thought I'd talk about warts for a second. So a wart is just a virus. It's the human papilloma virus that somehow invades your skin. So it has to have a little break in the skin or something, and it can get into the dermis, that's the upper skin layer. And the problem with warts are they evade your immune system, so they're not recognized very easily as a foreign virus, and so they create a wart, which is a certain little lesion. Um, they're not normally a problem, but they can obviously become painful, especially if they are on areas that you put weight on. And so we like to treat them if they're in that space. They can also obviously spread to the other family members or to the other foot. So we like to get a handle on them. But they're a challenging thing to treat. So you would have probably heard of the normal freezing and icing. Some people have it cut out, but it can cause a little bit of scarring. There's a needling technique that we sometimes use, and sometimes we use a strong acid in clinic. There's obviously off-the-shelf pharmacy things and things like that. And they work okay on areas that's not underneath the foot, but they take a lot of diligence. So generally, we find that because it invades the immune system, a lot of patients have had it frozen 12 times, and those are the patients we see a lot. And we're very fortunate to have the Swift, which is the awesome microwave technology that's been developed. And it's a great system because what it does is it uses a heat shock to the area, um, and then it creates these little irritation that cause the protein and dendritic cells, which are the cells that recognize the virus as foreign. And so your immune system ends up treating the wart. It's a great protocol because there's no wounds, there's no aftercare, there's no dressings, there's no acid. You can carry on with your life as normal. You can go swimming, you can carry on as normal. So we treat it normally once every 4 weeks for 3 visits, and then we do a 12-week follow. So we give the immune system a bit of time to sort it out. It's a little bit uncomfortable when we're doing it, but it's very quick. And in my years of experience, it's definitely one of the easiest ways and most hassle-free ways to do it, and also one of the most successful. So we've had great results with it. And so if you want to find out more about warts or wart treatment, we'd love to get in touch, chat to us, send us an email, book online, come see us. We'd love to help you out with it.